Eric, thank you very much. And the concerns through the community, throughout the community, certainly feeding the phone bank tonight as our hour continues. All four Fort Wayne television stations, the show being heard on commercial and public radio as well. Conversation and questions being addressed on the phone and online with the numbers you see on the screen, the toll-free number as well, the 866 number. Some of those questions that have been coming in have been dealing with the complications, the proposed or concerned complications, possible ones, of the vaccine as it interacts with existing medical conditions. Another dealing with other options for fighting H1N1 without necessarily taking the vaccine. Is there a course of vitamin regimen that would be possible for taking this? And again, getting back to the basics. How do I know if I have this? If I know it, then what do I do about it? Those are the questions. We'll keep on answering them. And let's go over to Heather Herron now with Dr. McMahon.
Okay, thank you, Bruce. We do have answers to those questions and many more. Thank you so much for helping clear up some of the confusion and misconceptions about what exactly H1N1 is and how it compares to the seasonal flu. Let's answer the question that a viewer had about non-vaccine ways to prevent the flu, some of the more holistic ways to do that. Are there some of those, and what would they be?
Well, I think the best thing would be obviously those tried and true things of washing your hands, staying home when you're sick, coughing in your sleeve, those types of things. But I do think that one thing that people can do is really do the simple things that really help boost your immune system. You don't have to do a lot of different supplements. You just have to have a good, healthy diet where you have a lot of fresh fruits and vegetables that have the natural antioxidants and vitamin C and stuff that will actually naturally boost your immune system. But the number one thing I think that most people don't do that they need to have an effective immune system is get enough sleep. We are in a rush world and everybody's going on 6 hours. If you can make sure that you get enough sleep, make sure you get at least 7-8 hours a day, that's really going to help you. And all those things are natural ways to boost your immune system and fight your defense. But again, you want to make sure that you wash your hands when you come in contact with different foreign objects, handrails, doorknobs, those kind of things. That'll really help you as well. And
those things would apply, I assume, let's say you have several children in the home, a sibling comes home and has the flu, whether it's the seasonal or the H1N1, what are some other things that maybe steps you can take in your own home to keep it from spreading to the other family members?
Well, first of all, you want to make sure you have everything you need on hand because you don't want to be, especially if you're the ill one, you don't want to be going out to the store and buying things. So you want to make sure you have things like a thermometer, at least one for every person in the family. You want to have things like Tylenol and ibuprofen that you can bring down a fever. You may want to alternate the two, especially with children because they tend to get higher fevers than adults do. You also want to have things like cough medicine, expectorants. The other thing that can really happen is that people can get dehydrated very quickly, especially the very young and the very old. So those are things that you want to have, things like Gatorade, Pedialyte, those kind of things to make sure people don't get dehydrated. You also want to have things like paper plates, paper cups, napkins, paper napkins, so that you can feed the ill person their soup and their broth and stuff in those types of throwaway utensils so that you don't have to worry about transmitting it to other people in the family. And make sure that once you've identified someone in your family that has it, that you go around and just take a bleach wipe or a wipe and do the doorknobs, the keyboard, those kinds of things, surfaces that they might have touched and infected.
Yeah, the telephone would be another one of those easily spread the virus. What about people who have pre-existing conditions, people who have diabetes, who have asthma? How should those people be treated? Any differently?
Oh, very good point. Not only should you immediately call your doctor and let them know that, gee, I've got a fever and a cough, I might have influenza, but remember I have diabetes or I have asthma. That might trigger a prescription for an antiviral. But the other thing is, you've got to remember that when you get an infection like this is not a cold. Influenza is more serious than that. That can make, if you have a pre-existing condition like asthma, you can have an asthma exacerbation. You could have your diabetes. You could be having the same diet, same everything, but all of a sudden your blood sugars are out of control. The other mistake that people make is if they have diabetes, if you're on a clear liquid diet, don't take your normal medicine because what you're going to do is bring your blood sugar down too low. Those are just some simple things. If you have a chronic health condition, remember that a severe infection or even a mild influenza infection can actually trigger an exacerbation or worsening. So let your doctor know.
Now, Eric touched on this in the last segment, but when do we know that it's okay to go back to work or school? Because that will, of course, help stop the spread of it.
It's so important that people stay home for two reasons. Stay home until for 24 hours after your flu has subsided without any medication to bring it down. Unless you're a healthcare worker or you take care of small children, then you want to stay home for 7 days. But the other thing is you really want to give your body time to recover. Again, this isn't a cold. This is influenza. Your immune system needs to heal.
Okay, good information. Thank you very much. We are going to send things back over now to Jim Blue from Fox Fort Wayne. Wayne.
All right, thanks very much, Heather. And once again, I'm here with Carrie Maffio, who's with Butler University's College of Pharmacy and Health Sciences. Let's talk a little bit about something we haven't talked about up till now, and that is these antivirals. Not a vaccine, but something that somebody could take if they were really sick with the flu and their immune system might be compromised. Tell me what's out there that could help people like that.
Perfect. Currently, there are two medications, antivirals, that are available to treat zanamivir and oseltamivir.
You said that very well.
Thank you.
I couldn't say it. But these things do what?
Yes, what they do is they prevent the virus from replicating. And what they do is they help treat the actual infection. So vaccines help prevent, and these two medications actually help treat the infection.
Gee, I want that. If I get sick, I want that.
Well, what we're doing is we want to make sure that these medications work. We don't want these viruses can develop to evade and not work as well if we use them broadly, kind of like antibiotics do with resistance. So we want to make sure we're using it in the groups of people that are candidates for that.
And they are?
We want to make sure that we use those in people that are 65 in age and older, if they're under 2 years of age, and I think
pregnant women?
Pregnant women, yes. And then if you are hospitalized, if you require hospitalization, and then if you have a chronic health condition. And certain health conditions, certain like heart disease, diabetes, if you have a respiratory condition, and then if you are younger than 19 years of age and you're on chronic aspirin therapy. One thing with the age is if you are under 2, you are at increased risk of complications for influenza, so that is the priority group.
I see. So, but okay, so I get sick and I go to my doctor and I say, I really want that. I mean, that would get me done with this flu real fast, but you say that's just not the way we should do any of this, right? Really,
we want to focus on the people that are going to be at the greatest need for these antiviral medications. The one thing that's important to know is that if you are in any of those priority groups, or if you have a chronic health condition and you do develop flu-like symptoms, to call your doctor immediately. These medications are most effective if you start them within 2 days or 48 hours.
You have to do it that quickly?
It is best to use those. They're most effective when used as soon as possible.
Okay. Now, why is it that I can take an antibiotic for something like strep throat, but there just aren't a lot of drugs out there that work for viruses?
Exactly. There are a couple of other antivirals, but these are specific that actually have been shown to treat the 2009 H1N1 influenza virus. So these two medications are the ones that have been shown to be effective.
There are other antivirals out there, but these are the ones that work with this particular kind of H1N1 concern. All right. Now we talked earlier. And we only have a minute left here, but we talked earlier about some of the vaccine issues and that kind of thing, and people's concerns about getting the vaccine. 40% of the people are saying, I don't want to go get vaccinated. Should they be that worried, or should they be that sanguine about it?
The best way to protect yourself against the H1N1 virus is to receive the vaccine. That is your first way to help prevent, obviously, frequent hand washing and covering your cough. But really, when we look at the information we have available, we know that the priority groups that should receive the vaccine, that is the best way to help prevent widespread of this outbreak. All
right. Now, I'm above the age which you are going to be vaccinating most folks. So should I be concerned about that? Should I be worried? I'm in my mid-50s. Should I be worried that I'm not going to get vaccinated early? No?
When the vaccine, there will be enough vaccine available.
But I have to wait.
You have to wait.
All right. Thanks very much. Carrie Maffio, Butler University. We'll go back over to Eric Olson of Indiana's News Center.